loose, watery stools, frequent trips to the bathroom, this could mean that you have diarrhea. And in this video, we're going to discuss exactly what diarrhea is, some causes of diarrhea, when to see a doctor if you have diarrhea, and then lifestyle changes you can make and over-the-counter medicines you can take to relieve your diarrhea. Stay tuned. Greetings, this is Brandon E., your Pharm.D, and welcome to my YouTube channel. You know, all of us have experienced diarrhea at some point in our lives, but what exactly is diarrhea? Before we talk about what it is, let's talk just a little bit about digestion. Digestion really starts in our mouth. We eat food, we chew it, it mixes with enzymes and saliva in our mouth, and then it goes to our esophagus and then to our stomach, and from our stomach, the food goes to our small and large intestines. And in our small intestines, water and nutrients are reabsorbed or absorbed into the body. And then from there, they go into the large intestines where stools are made and more water can be reabsorbed. When food in the intestines travels too quickly through the intestines, you can get these loose and watery stools. And this can be because the cells in the intestines become irritated. So if you have loose and watery stools that happens 3 or more times a day, this is what's considered diarrhea. So what are some causes of diarrhea? Number one, medications can cause diarrhea, as well as stress and anxiety, food poisoning, certain medical conditions like irritable bowel syndrome or celiac disease if you eat gluten, menstruation in women, poor gut health, and stomach flu. So now when should you see a doctor if you do have diarrhea? You should see a doctor if you have blood or mucus in the stool, fever, diarrhea that lasts more than 2 days without improvement, dark urine or producing only a small amount of urine, confusion, and irritability. So now let's talk about some ways to prevent diarrhea. And as you know, with this channel, we don't just talk about medications. We like to take a more integrative approach to treating your everyday conditions. So the number one way that we can prevent diarrhea, and we talked about this in the previous video on constipation, so check out that video when you're done watching this one, and that is to get an adequate amount of exercise. As we mentioned earlier, stress and anxiety can cause diarrhea, so exercising regularly could potentially reduce our stress levels and indirectly cause us to have less diarrhea. And as we mentioned in the other video again on constipation, most Americans aren't getting enough exercise. According to the CDC, only 46.9% of Americans are getting the adequate weekly amount of exercise. And that is 150 minutes of moderate intensity exercise like brisk walking. And you can break this up and do like 30 minutes 5 days a week, or you can do 75 minutes of more intense exercise like jogging or running. And again, you can break this up and do like 15 minutes 5 days a week. So again, if you exercise more, this could reduce your stress and anxiety levels, leading to less diarrhea. Also, you want to be conscious of the foods that you're eating. You want to avoid foods that can cause diarrhea, like things with caffeine, alcohol, sweetened juice, or a lot of prune juice or diet drinks. And if you're not sure if you're eating certain foods that can cause diarrhea, you can make a food diary to identify triggering foods. A food diary is just a daily log of what you eat and drink. And then if you notice foods are causing diarrhea, you can eliminate those foods from the body and then replace them with foods that don't cause diarrhea. Also, you may need to change your eating habits. Sometimes when we overeat, this can lead to diarrhea. You want to try eating more slowly. It takes about 20 minutes for your stomach to tell your brain is full. So if you chew your food more frequently, more thoroughly when eating, and you want to slow down and don't gulp down your food as much, you may also benefit from eating smaller and lighter meals, which are easier to digest. So now let's talk about some treatment options for diarrhea. When you have diarrhea, the number one treatment option you want to make sure you're undertaking is to drink a lot of fluids, a lot of clear fluids. I personally would recommend drinking natural spring water bottled at the source, because this water is not only hydrating, but it also has electrolytes. It has things like sodium, calcium, and magnesium. You can also do oral rehydration therapies and Pedialyte, and broth may be a good option as well, as it has water and electrolytes. The next treatment option is to avoid foods that can make your diarrhea worse, like dairy products like milk and butter and cheese. You also want to avoid greasy foods and foods that are very fattening, again, as this can make your diarrhea worse. You want to focus on more bland foods. There was evidence, or was widely recommended, to eat a brat diet for many years: bananas, rice, applesauce, and toast. But then there's been some discrepancy that this diet is too restrictive. But you don't necessarily have to stick to these foods, the brat diet, bananas, rice, applesauce, and toast, but focus more on bland foods, and again, stay away from the dairy products. The next treatment option is to wait it out. Generally, when we have diarrhea, most times it'll resolve on itself in a day or so. So as long as you're staying hydrated and drinking proper amounts of fluid, you don't necessarily have to do anything else. But a lot of times in our society, if something happens to us, we immediately want to take a pill or do something. I know this from working in the pharmacy. People will come in and ask for recommendations, and I will tell them, you really don't have to do anything. It'll probably get better on its own. And they would just hound me. What can I do? What can I do? And I may just recommend them something they don't really need, but it won't really hurt them because they're hounding me for something that they could take. So in this case with diarrhea, and this is assuming you don't have an undiagnosed underlying condition. Again, that goes back to, if you're having symptoms more than 2 days, you probably want to see your healthcare provider or your doctor. So wait it out. Now we're going to talk about over-the-counter medicines we can take for diarrhea. The first of which is Imodium AD with the active ingredient loperamide. Or if there's like a store equivalent, that's okay to take as well. And what this medicine does is it works on what are called opioid receptors in the gut. And as a result, you have less contractions in the intestines, so food and water are going to move through the intestinal tract more slowly, so more of the water can be reabsorbed. This medicine works very well, and if you're on any type of pain medicines or opioids, it's similar to how the opioids work. And many people who are on chronic pain medicines, they have to take laxatives because these medicines are naturally constipating. And again, this loperamide or Imodium works kind of like these opioids. The next over-the-counter medicine is Pepto-Bismol or bismuth subsalicylate. And this medicine actually coats the stomach and can kill some of the bacteria that are causing the diarrhea. And then there's also probiotics. If you're self-treating over the counter, they may or may not help you. I like probiotics in the sense if you're taking antibiotics. Probiotics are an option. I'm not going to talk about it too much, but if you want, I can do another video and we'll go over that. So now let's put everything together. Let's say you're having diarrheal symptoms. What should you do? Number one, you want to do the things that try to prevent it from the first place. You want to exercise regularly, do a food diary, and do what you can to prevent you from having the symptoms. But if you do have the symptoms, number one, you want to drink a lot of water and drink a lot of fluids. And again, I like natural spring water because it's hydrating and has electrolytes. You want to make sure you're avoiding foods that are making the diarrhea worse. You want to eat bland foods and avoid dairy products and avoid greasy foods. If you have symptoms and they're severe, you can take an over-the-counter medicine. You can take Imodium AD or you can take Pepto-Bismol. Now, Imodium AD is good for just diarrhea, whereas Pepto-Bismol helps with heartburn and nausea and indigestion. So if you're having diarrhea and some other symptoms, Pepto-Bismol may be a good option. For just having diarrhea, you can do Pepto-Bismol or Imodium AD. But in most cases, again, you really may not even have to take one of these medicines. You can just ride it out, wait it out for 2 days, and you'll probably get better. And if you like this video, let me know in the comments. And if you want me to elaborate on any particular topic, I can do another video or answer your question in the comments. This is Brandon E, your Pharm.D. Remember to drink water, and hope this video helps.